When I was told that I was diagnosed with cancer, it was kind of scary. I didn't know what to expect. The chemo, I didn't know if I would have side effects, but after doing some reading and the doctors and staff prepped me to what to expect, it wasn't as bad as I had anticipated. What I try to do is come in with a positive attitude because they're here to help. And I think if you come in with a smile on your face and with a positive attitude, that makes their work a little bit easier.
Many of our patients don't know what to expect with chemotherapy. I find it best to provide patients with educational materials, resources, and options when deciding on treatment. It's very comforting to the patient and families to get all this educational material. They get material they can take home and review, and also to meet our staff and tour the cancer center.
Chemotherapy drugs are used to stop cancer cells from growing. They can reach and eliminate cancer cells at sites great distances away from the original cancer location. Your treatment can be administered through a vein or a port if you have one, or you can also take it orally in the form of a pill or a capsule. Immunotherapy refers to a group of drugs that stimulate the immune system to indirectly affect tumor cells and kill the cancer.
To prepare for your treatment, we recommend a good night's sleep, breakfast, or meal prior to treatment. Take your medications as normally scheduled and bring a friend or a family member to help ease your nerves. More importantly, just remember the nurses are here to explain everything, and we will be here every step of the way. After checking in with the front desk, the medical assistant will call your name and take your vital signs and wait. We do this every time you have an appointment with us. If your doctor has ordered blood work, we will obtain and review it to determine if you are ready for treatment.
Your doctor develops a treatment plan personalized to your diagnosis and cancer characteristics. Prior to each treatment, you will be seen by your doctor, a nurse practitioner, or one of our oncology nurses. The length of treatment depends on your individualized treatment plan. When indicated, medications will be given prior to your treatment to help minimize side effects. Your nurse will let you know how long your infusion time will be.
Our patients are able to sit wherever they choose in one of our comfortable recliners. We offer television, magazines, Wi-Fi, and you can bring a book or other hobby to occupy your time. Patients are able to eat and drink during treatment. You're welcome to bring in your own food, or we do have snacks available.
Some patients expect to feel differently during their treatment. They've heard so many stories from other people or perhaps seen things on movies or television, and so we just want to reassure them that it's going to be rather anticlimactic.
For the patient that's first coming in, you probably worry, let's just say this, come in with a positive attitude because the staff, the nurses, the doctor, they're here to help you, and they're trying to make your life much easier.
While the treatments are working to fight your cancer, they can also cause side effects. Side effect management has come a long way in the recent years. Today, many of the side effects can be prevented or controlled. The side effects vary based on the treatment that you receive, but some common side effects of therapy can include changes in your lab values, nausea, and fatigue. You may experience some of these side effects or none at all. We encourage patients to take an active role in managing their side effects by keeping track of what they're experiencing at home and making sure that they call us with any questions or concerns.
There is a team of caregivers at NCS, and we are available and want to help you along the way. We want to make your treatment as effective, timely, and problem-free as possible. It's very important that the patient and the family and the physicians and nurses all work as a team so that we can manage these side effects and help prevent them.
After I had my bone marrow stem cell transplant, there were some things that I was not able to do like I did before, and that was quite an adjustment. My grandsons helped out a lot. They're a lot of energy, and so that kept me pretty lively as well.
Receiving a diagnosis of cancer and going through treatment can be stressful for some. I think it helps people if they can stay positive as they go through their treatment. It is also helpful to have a good understanding of your diagnosis, treatment, and outcomes. Some patients may feel depressed or anxious while going through treatment. We want our patients to know that these feelings are very normal, and there are things we can do to help with these feelings and will support you on your journey.
For any spouses going through this trial, this bump in the road, remember that just being there to give him the support he needs during the hard times, because you know that the staff is there to make sure that everything goes right with him and to make sure his healing process is as comfortable as possible. And being patient being open-minded and being receiving to what the staff and the doctors have to give to him, and just always being there for him. Okay?